Hello, I'm Mike Biselli, your host for this podcast and the global community that has rallied around it. During this episode, we spent time with a seasoned healthcare innovation leader and serial entrepreneur who has been positively impacting our nation's health for many years and discussed why he is dedicated now more than ever in furthering his life's mission. Kevin Riddleberger is a co-founder and chief strategy officer for Dispatch Health, a company laser-focused in creating the most advanced and complete in-home care model in the world. By offering on-demand healthcare for people of all ages in the comfort of their home, Dispatch Health is helping to reduce unnecessary emergency room visits and hospitalizations and is improving clinical outcomes while decreasing burdensome costs for the overall healthcare system. While together, Kevin highlighted the journey him and his team have been on over the past several years while building their high-growth company, as well as how Dispatch Health is meeting the current needs of their communities due to COVID-19. Additionally, Kevin shared insight as to what the future and expanded model at Dispatch Health will look like, which is incredibly exciting and inspiring. I'm eager for you to learn from Kevin, someone who I highly admire and is an industry leader who is deeply passionate and committed to moving the health of our nation forward for years to come. Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us. Kevin, welcome to our podcast, and thank you for being with us today.
Thank you for having me. Really excited to have this conversation with you.
Well, Kevin, I'm grateful for the many years I've been able to call you a friend, a mentor, and someone I highly admire. So as you can imagine, I'm fired up to have you on the podcast today and for our global community to meet you and to learn about all the wonderful work happening at Dispatch Health. But before we dive into the inspiring work happening in your camp, a bit of housekeeping. While listening to any of our episodes, please make sure to join our free online community at passionatepioneers.com in order to share feedback and ideas and to interact with the global ecosystem. If you're listening to this episode via our online community, thank you for being with us. Lastly, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. All right, Kevin, it's almost time to learn how Dispatch Health is creating the most advanced, on-demand, in-home healthcare model in the country. But first, let's take a moment to break the ice a bit so our community can get to know you. I'm going to select one of three questions here. All right. Well, this is probably more salient than ever, given we can't really travel at this time with the pandemic. Where's your favorite place on Earth and why?
Great question. I've traveled to many great places doing medical missions in Rwanda, India, but my favorite place is going to Kauai, Hawaii. So I'm able to escape, love the culture, love the speed, being able to get in the outdoors, hike, water sports. It's just a place for myself and my family to really get away and enjoy everything that Kauai has to offer.
Now, in regards to Hawaii, you're now, I think, the third or fourth guest that has mentioned Hawaii, and I'm a big fan as well. I've gone to Maui a number of times. I have not been to Kauai. Have you been to other places in Hawaii, and why then Kauai, if so?
Yeah, I've actually been to most of the Hawaiian Islands, and I keep on coming back to, when I first went to Kauai years ago, I said to my wife that this is heaven. And we've gone to other islands. My wife has a dermatology conference that rotates on every Hawaiian island every year. But we keep on, gravitating back to Kauai as kind of our place. That is a nice opposite of the fun that we have up in the mountains here in Colorado as well. But yeah, Kauai's a place.
Yeah, I've heard that from many friends. So definitely on the list as well. So, well, thank you for sharing that, Kevin. Hawaii is a great place for sure. Well, you and the Dispatch Health team, you've been at it now for almost 7 years. I can't wait for the community to hear about all the wonderful work happening in your camp. But of course, you and Dr. Prather just didn't, one day arrive to operating this now national company. Can you take us back a bit, Kevin? Rewind the clock, share a little bit of your journey of how you are now today's chief strategy officer and co-founder of Dispatch Health. But share that backstory because I know it's so important. I've been able to spend a lot of time with you, and it is a great backstory. So if you could rewind the clock for us a bit before the days of Dispatch Health, and then we'll dive into Dispatch Health after that.
Yeah, no, I think it dates back. I've been in healthcare for 20 plus years. I practiced as a physician assistant for about 12 years here in the Colorado area, as well as in Atlanta, Georgia. And I was always striving, wanting to push healthcare forward, but restricted in a way in terms of how we were in that daily grind of seeing patients every day, and really boxed in to a degree as to what you could really do and shape to be able to push healthcare forward. And so I was craving to learn more, went back to business school to learn really the aspects of how healthcare operated from a business standpoint, and jumped ship. I thought I was going to go up more of a health administration route and jump ship from clinical medicine to get my feet wet in a startup world with a company called iTriage. This was a company that started in Colorado by a couple ER docs. And, I just loved the energy in that startup, world, where you're able to bring kind of that knowledge from the business side as well as a clinician to actually changing healthcare on a daily basis, by leveraging technology, software development. That's where I met my co-founder, Mark Prather, who is a ER doc, where we got talking about, how could we take the next step to be able to push healthcare forward. If you remember with iTriage, which was acquired by Aetna, was helping patients direct them to the appropriate level of care using a mobile app and a symptom processor that we built. We wanted to take the next step and to be able to push healthcare and deliver that healthcare to patients where they were at inside the home. And so that's where we had an opportunity to be able to study a model back in 2013 with a partnership with an EMS agency here in the Denver area to be able to study, could we deliver safe care through the 911 system, and to be able to deliver that care to them where they were at a high quality at a low cost. And we had great success over the course of that 18-month proof of concept pilot. And that's where we really got the momentum to push Dispatch Health, forward.
And so, again, that was a number of years ago. And of course, any good startup, things pivot, things change, and you kind of find your niche in the marketplace. How much has Dispatch Health changed since those early days? And when did you guys really find your swim lane and that aha moment, like, okay, we are definitely on to something?
Yeah, and it seems like every 2 years, we've added different capabilities onto our platform of delivering care in the home. Like I said, we started in the EMS space back in 2013. We continue to operate in the EMS space, and there's a lot of actually exciting work that's happening out of CMS, CMMI, relative to the ET3 model of care, which technically we've been working and delivering for the last 7 years. So a lot of work, still happening in the EMS space and continue to operate there. We then, in 2015, put vehicles on the road where individuals could actually contact us directly for their acute illnesses and injuries. And so this is really what Dispatch Health is known for to a degree, to be able to intervene, deploy a medical team to be able to avoid ER visits inside the home. Then in 2017, as we started to expand our partnerships with health systems as well as payers, there was an opportunity to be able to help those entities decrease their readmissions on patients that were transitioning out of the hospital. These are the top third of patients that are sick and identified as a high risk for readmission, or they may have a social gap or a extended amount of time to be able to get back into the primary care physician. We were then intervening to be able to help proactively treat those individuals 24 to 72 hours after their transition out of the hospital to decrease those readmissions. And then in 2019, really spent the whole year and then deployed this model in 2019 to deliver hospital level of care inside the home. SEMA and team at CMS is now coining this as hospital without walls. We're now delivering hospital level of care, individuals that actually meet admission criteria inside their home. So never actually stepping foot into the hospital or the ER at all, we're able to wrap those more advanced level of care around them. So, if you think about it, EMS, ER, SNF substitution, hospital, substitution. We have some, great value prop, relative to driving high quality of care as well as decreasing the cost of care of caring for individuals safely inside the home.
Well, thank you for that. And Kevin, we're going to dive a little deeper into that here in just a moment. But I want to go back to that moment in 2015 where you mentioned we're starting to have these cars, we're taking them to the patient. But that just seems completely antithetical to how the healthcare industry was built, right? Where we think, oh, we have to have, heads in beds. We have to have patients come through the doors. We have to have these billing events. Did the industry or executives in the industry think you and Dr. Prather were nuts for this idea? I'll stop there because, again, it's this orthodoxy of that's how it's always been. But when you had this model in 2015, did people look back at you and think you guys are crazy?
Yes, to a degree. I mean, we're not in the typical playbook of healthcare delivery. And so if you look at the history in terms of care in the home, obviously people think about skilled and non-skilled home health agencies delivering, care in the home. That has continued to rise. You then look at individuals actually delivering home-based primary care. And there's a great demonstration project out of CMMI with Independence at Home, and that continues to operate and have great success for Medicare beneficiaries that are, homebound to be able to deliver that care. There wasn't anyone delivering care for ER substitution, so a high acuity level of care, bringing, a CLIA lab into the home, bringing an ER trained provider, into the home, being able to suture up lacerations, being able to place Foley's, replace G-tube replacements, into the home. There was no one doing that. And so we really had to carve that niche, work with our payer partners on determining, all right, how do we actually get paid for the service? There really wasn't a revenue model, for us as we built the company. And so we've had to work really closely with our payer partners to be able to continue to demonstrate value to them, demonstrate how we are removing costs within the system, which we know we are not doing a fantastic job of historically in this country is to drive value in healthcare. And that's exactly what our mission is centered around, is really that quadruple aim. And it just is so reassuring that we're actually delivering on that quadruple aim, from improved provider experience, improved patient experience, improved clinical outcomes, and improved cost of care. And so it's been great. It's been a ton of work, but very fulfilling, over the years to be able to scale our model across the country, now treating over 175,000 patients, over the last 5 years.
And how about some of that feedback from the patient? I've seen some of the feedback and actual stories in the media here locally, but it seems like the patient is just absolutely loving this model. Do you have anything to share there for the audience?
Yeah. And so, we are very, very focused on the end-to-end, patient experience. It's something that, to be honest with you, has lacked in healthcare. From, if you look at your typical, last time that you went to the emergency department, for care, probably not a wonderful experience, from, driving yourself there, to the waiting room experience, to, to the staleness, of being into the ER itself, and then getting yourself back home after that. A lot of fragmentation around that whole experience. And so we have really focused on, how patients interact with us, how we care for the patient, how we follow up, with the patient, to make sure that it is world class. And, it's demonstrated through our Net Promoter Score. If you look at, typical healthcare organizations, their typical Net Promoter Score is around, 20, 30. Our Net Promoter Score after 100,000 reviews is maintained at 95, which is, somewhat unheard of in healthcare, and really any industry. Apple, I believe, is a little over 70 from a Net Promoter Score. perspective. And so, it does tell a lot in terms of what patients are really craving for, that they are actually receiving in many other industries. They're getting their food delivered. They're getting, packages, the next day after an order, online. Why not get your healthcare, from the comfort of your couch, and to be able to, be, in that living room, side by side with that patient, and delivering that care, to the patient versus, seeking out the provider on the provider's time, and not on the patient's time.
Well, I'm going to share a personal story because I'm one of those 100,000 in regards to that net promoter score. Kevin, you might remember this. And before I share this story to the audience, I am receiving zero remuneration for what I'm about to share. It was about a year ago, and I was very ill. We're a one-car family. I'm at work, and actually one of our mutual friends, Dr. John Freilich, one of the co-founders over at Sopris Health, with one of your good friends, Patrick Leonard, he said, Mike,
Yep.
you definitely need to get a prescription for an antibiotic, or your cold may turn into a pneumonia type situation. And I'm like, well, I don't have a car. Maybe I can just do a telehealth visit with my primary care. I call them up. They literally said to me, what do you mean by telehealth? I immediately hung up. I texted you, Kevin, and I said, can somebody from your team help? And you immediately text me back with the call-in number. And I kid you not. And you go, Mike, they'll probably be there within 10 minutes. They got there at 11 and a half minutes, and you heard about it, and you texted me back apologizing for them being there in 11 and a half minutes, not less than 10. And I was just ecstatic because they trying to find parking around my building in downtown. They came into my campus. We set up in a room. They took care of me. I couldn't believe the experience. It was absolutely wonderful. So I know I'm an N of one, Kevin, but I definitely wanted to sing the praises because it was an incredible experience for me and my family, given our circumstances.
No, it never gets old hearing those experiences. We hear about them, a lot. The geriatric patient, population who we care for a great deal, as well as, younger populations as well too. It's always great, and to hear those stories.
Well, let's also talk about, obviously, here we are in the midst of COVID-19, and just the terrible tragedies happening around the nation with this pandemic. Can you share a bit where Dispatch Health is? How are you serving your members across the country? What has this pandemic meant for your organization? Maybe you can share a bit more there as well.
Yeah, I mean, it's been challenging, overall. And I speak on behalf of my clinician colleagues, whether they're in private practice or in health systems. This is something that was not planned for, at all. And you have to pivot, very quickly to be able to safely deliver care to patients, to be able to protect your own clinicians. I mean, we employ, probably 300 or so clinicians across the country. And in various parts of the country were impacted to various degrees. We have operations in the Northeast where they were hit extremely hard. We have operations in Seattle where the initial outbreak, did occur. And so, if you think about our operations, and we did open a new city amidst all this COVID pandemic, 19 different markets that we operate in, we needed to standardize the way that we were delivering care in all of those practices. And that goes to how patients upfront relative to their symptoms, to make sure that we were clinically sending out the right team to be able to take care of those patients, as well as getting the right personal protective equipment, or PPE, for our clinicians to be able to go out and safely take care of those folks, inside the home, to infectious control. So making sure that we had, the right process in place as we were going to patient, delivering care. And I think, the silver lining to all of this, and I try to view, the positives around this, is that culturally, we really bonded internally. I mean, we have now 700 employees within the Dispatch Health, team. We got a small group, together that met every day multiple times a day around the pandemic, and getting everyone oriented and rowing in the same direction. Great communication out to the team, and everyone really rallied around, and I think it built up our culture more and more. It also really highlighted the importance of delivering care inside the home. And that's a space that we've been in, obviously, for the last 7 years. And I think it will continue to be viewed more so now, as a place, as a great place to be able to access care, to be able to deliver care, and whether that's through virtual capabilities or in person. This is not going away. The cat's out of the bag, and we're going to see more and more innovation, which is exciting for me overall.
Well, that's exciting. Thank you for sharing those updates there, Kevin. And let's also talk about a little bit future state for Dispatch Health. I typically ask leaders like you, pre-COVID, what does it look like in the next 3 to 5 years? But as you know, things are changing almost by the day, by the week. What does Dispatch Health look like? Where do you see things in the next 6, 9, 12 months? You mentioned telehealth and others. Where do you see things heading, not just for the industry, but also for Dispatch Health?
Yeah, I mean, it's there's a lot going on, right now in the industry. We are set out to build, a system of care inside the home, the hospital without walls, and we may not perform all of those services, ourselves, but we're going to be partnering with the right folks to be able to really provide a system of care, inside the home, and I'm very bullish around this. I think we have the right tools in place. We're now having tremendous results of admitting patients with hospital level, admission criteria, CHF, COPD, pneumonia patients, hyponatremic, patients safely inside the home, avoiding the hospital altogether. And so if you think about this system of care inside, we have the ER team out in the home. We're able to right size that care, send out the team to be able to treat those individuals in the home. Historically, about 68% of those patients we need to escalate it to a higher level of care, and that higher level of care is the hospital. What if we actually provided a more advanced level of care where the patient would never have to leave the home at all? Typically, you go into the ER, you get worked up, you get sent upstairs to be admitted. Well, we're now admitting those patients directly into the home and being able to care for them in the home with everything that you would imagine of receiving in the hospital. So I would argue better food. We're arranging the right food for the patients. We have hospital level hospitalist internal medicine trained physicians managing these patients. We have bedside nursing coming to the home. We have medications being delivered into the home. We have imaging studies. We have durable medical equipment coming to the home. All of this is really being orchestrated by our logistics platform that we've built to be able to move different resources to point A to point B. And so that's the things that you're going to be seeing more of in the future, where health systems, executives, payers are going to be saying, hey, maybe I don't need to build a new wing, within the hospital at $2 million per bed. Maybe we can actually leverage the home as a place to be able to deliver even higher level of care, whether it be primary care, home health, virtual care, ER substitution, hospital substitution care, inside the home. So it's pretty exciting. You may hear it in my voice. I'm pretty jazzed up about the future of Dispatch Health, as well as there's just the industry itself. I've seen so much creativity, innovation occurring that I've never really seen in the last 20 years, right now, and how we're positioning ourselves in the future as we have this new norm that we're going to be operating in as healthcare providers.
Well, bringing back the house call supercharged, very exciting. I mean, these are the things that I think patients and now consumers, as we start thinking about that, that's what they're going to expect. That's what they're going to demand. And Dispatch Health is helping lead that charge. So thank you for sharing that vision, Kevin. It's so exciting. What a time. Let's also now flip the script a bit. I'd love always to get our community involved. We have an amazing global online community that's rallied around this podcast, a lot of them being industry leaders themselves. Can you share with our community, Kevin, one problem, need, or question that you or Dispatch Health currently have that we can be contemplating or helping you with?
Yeah, no, I think Dispatch Health is obviously not going to solve all of the healthcare problems, and there's within our industry, we want to be a piece of the puzzle, and so it's making sure that we bring the right people together from a collaboration standpoint to be able to serve patients safely and safely inside the home setting. And I think that really starts to bring in community resources. So I don't know if you've talked previously about just the role of social determinants is really having moving forward, and I think that's going to be a bigger play. We have tremendous data around gaps, in care, whether it be transportation or food or fall risks, or the inability to really pay for their medications that we're privy to when we're in the home. How do you then, connect those patients to the community and really align around a payment model to be able to get those services to those patients that really need those services to be able to recover from their conditions or just get back to a steady state. And so I think that's going to be more important. Collaboration between providers to payers, hopefully the government, CMS and Medicare and Medicaid, we can see some payment and some incentives around being able to provide non-traditional healthcare to patients to be able to get them back to a healthier state. And so that is one area I think we all need to just continue to brainstorm and develop solutions, because we know that there's positive outcomes that do come out of this, but we need a more sustainable model to be able to make this standard practice for all of us.
Yeah, we actually had Manik Bhatt, the chief strategy officer and co-founder of Healthify, on recently to discuss exactly what you're outlining right now, Kevin. And it is something that we all need to continue to grapple with, think through, and give some real dedicated attention to social determinants of health. I couldn't agree more. So thank you for, again, echoing exactly what Manik shared on a recent episode as well. So very important, and love to have the community think through how do we continue to tackle that. It is incredibly important. And well, more important than ever now, given the pandemic that's staring us in the face. So thank you for that, Kevin. As we wrap up, where can we find you online? Some social contact points, websites, or otherwise, where can we find you?
Yeah, dispatchhealth.com is our website. If you're a patient or consumer in the markets that we serve, you can download our mobile app on iOS, Android stores. I'm active personally on Twitter at K Riddleberger as my handle. So those are a few different areas that to find more information about Dispatch Health as well as myself.
Excellent. We'll also leave those contact points over at passionatepioneers.com, our free global online community. There'll be an entire article there with the contact points and more information for Dispatch Health, and for all of you to leave some feedback, questions, or ideas for Kevin and the team. So again, over at passionatepioneers.com. All right, Kevin, we're going to close it out here. We got to fill in the blank for you. One of my favorite parts of being able to spend time with leaders like you. Fill this blank in. And it is, I'm a passionate pioneer because
I want to be able to drive and push healthcare forward, passionate about being able to, fulfill the quadruple aim and, what we're doing and delivering that at Dispatch Health.
I love it. And you guys are certainly doing that. It's been an honor to be able to watch the evolution of Dispatch Health right here in Denver, Colorado, your headquarters. And of course, more importantly, It's an honor to be able to call you a friend, Kevin, and a mentor and everything that you've meant to me personally and professionally and otherwise. So on behalf of Passionate Pioneers and our community around the world, thank you for spending time with us today, especially given your very busy schedule. We're rooting you on. Keep us posted on any other future updates. But again, Kevin, thank you for being with us today. Always a pleasure.
Thanks, Mike.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.